Hello everyone, my name is Pranjal Fuse. I am second MBBS student from Dr. Ullas Patil Medical College, Jalgaon. Today we are going to study about broad spectrum antibiotics. Examples like tetracycline, tigecycline and chloramphenicol. First is tetracycline. Tetracyclines are obtained from soil actinomycetes. All tetracyclines are mildly bitter solids which are slightly soluble. It is a broad spectrum antibiotics and members of tetracyclines are doxycycline, oxytetracycline, minocycline, dimeclocycline and tigecycline. Then mechanism of action of tetracycline. Tetracycline binds to A site of 30S ribosomal subunit. Then prevent binding of tRNA to A site. Peptide chain fails to grow, which prevents protein synthesis. This means that tetracycline inhibits the growth and multiplication of bacteria, which means tetracycline is bacteriostatic. Then antimicrobial spectrum. Tetracycline inhibits all types of pathogen except fungi and viruses. Most gram-positive, many gram-negative bacteria, anaerobic bacteria are inhibited by tetracycline but not mycobacteria. Rickettsia, Coxiella, Mycoplasma, Chlamydia, Brucella, Spirochetes, Actinomycin, Protozoa, Helicobacter pylori. These microbes are inhibited by tetracycline. Then pharmacokinetics of tetracycline. Tetracyclines are incompletely absorbed from GIT. Absorption is better if taken in empty. Tetracyclines have chelating property and form insoluble and unabsorbable complexes with calcium and other metals. Milk ion preparation, non-systemic antacids and sucral fat reduce their absorption. It is widely distributed in body, concentrated in liver, spleen and bind to connective tissue in bone and teeth. It is metabolized by liver. It is excreted in urine by glomerular filtration. It is taken in the form of oral capsules and capsule should be taken half hour before or 2 hours after the food. Then uses of tetracycline. Tetracycline is used as empirical therapy and tetracycline is used as drug of choice in atypical pneumonia, cholera, plague, brucellosis, rickettsial infections. Then other uses of tetracyclines are amoebiasis, chlamydial infection, urinary tract infection, acute vulgarias, community acquired pneumonia. Adverse effects of tetracycline. Here you can learn adverse effect from a tree like Kapil Dev, in which K is for kidney damage, A is for anti-anabolic effects, P is for phototoxicity, I is for diabetes insipidus, L is for liver damage, D is for dentition, E is for epigastric pain and V is for vestibular toxicity. We see that tetracyclines have chelating property, which means it binds to calcium and form insoluble and unabsorbable complexes and it is collected in tissues like bones, teeth. Here due to this property tetracyclines causes brownish discoloration of teeth. Then other side effects like nausea, vomiting, diarrhea, superinfections. Another drug is tigecycline. Tigecycline is a derivative of minocycline. It acts in same manner as tetracycline, which means we see the mechanism of action of tetracycline, in which we see that tetracycline binds to 30S ribosomal subunit, which binds to A site of 30S ribosomal subunit, which prevents binding of tRNA to A site. Thus, peptide chain fails to grow, protein synthesis is inhibited, and tigecycline is bacteriostatic, such as like tetracycline. Pharmacokinetics of tigecycline. It is poorly absorbed from GIT. The only route of absorption is slow by IV infusion. It is widely distributed in tissues. Metabolism is by liver, and its elimination is mainly in the bile. T half-life of tigecycline is 36 to 60 hours. Dosage initially 100 mg IV infusion, then 50 mg IV infusion of 12 hourly for 5 to 14 days. Uses of tigecycline. Community acquired pneumonia, complicated skin infections, but it is not used in diabetic foot. Third is complicated intra-abdominal infections. Adverse effects of tigecycline. Nausea, occasionally vomiting, epigastric distress, diarrhea, skin reactions, photosensitivity, injection site complications. Then next drug is chloramphenicol. Chloramphenicol is an antibiotic produced by Streptomyces venezuli and other soil bacteria. Now it is produced synthetically. Pharmacokinetics of chloramphenicol are its absorption is by oral and it is 50 to 60% bound to plasma proteins. Distribution, it is very widely distributed in body. Metabolism is by liver and conjugated with glucuronic acid. Excretion is in urine. Mechanism of action, chloramphenicol binds reversibly to 50S ribosomal subunit. C. Tetracycline and tigecycline binds to 30S ribosomal subunit, but chloramphenicol binds to 50S ribosomal subunit, which prevents formation of peptide bond and inhibits protein synthesis. Antimicrobial spectrum of chloramphenicol. Chloramphenicol is primarily bacteriostatic, shows sidal effect on high concentration. It is more active than tetracycline against Haemophilus influenzae, B. pertussis, Klebsiella, Neisseria meningitidis, and anaerobes including Bacterius fragilis. Its uses are pyogenic meningitis, anaerobic infections, intraocular infections, enteric fever, brucellosis and rickettsial infections, and external ear infections. Adverse effects of chloramphenicol. First, bone marrow suppression, dose dependent reversible adverse effect, non-dose related effects which is fatal, hypersensitivity reactions, gray baby syndrome which is due to the lack of UDP glucuronide transferase enzyme in infants, and last is superinfection. Then MCQs. First MCQ is tetracycline binds to which part of bacteria? A. Bacterial cell wall receptor. B. 50S ribosomal subunit. C. 30S ribosomal subunit. D. 30S 50S interference. We see in the mechanism of action of tetracyclines that tetracycline binds to a site of 30S ribosomal subunit. So our answer is C, 30S ribosomal subunit. Next question. Which of the following is not true about tetracycline? A. It is a broad spectrum antibiotic. B. It is bactericidal. C. It causes tooth discoloration. D. Binds to 30S ribosomal subunit. A. It is broad spectrum antibiotic, which is true. C. It causes tooth discoloration. We see that tetracycline has chelating property and it causes tooth discoloration. D. Binds to 30S ribosomal subunit. And B. It is bactericidal. We see that tetracycline inhibits growth and multiplication of bacteria. Thus, it is bacteriostatic. It is not bactericidal. Bactericidal means which kills the bacteria. Thus, our answer is B. It is bactericidal. Third question. Tigecycline is derivative of A. Doxycycline, B. Oxytetracycline, C. Minocycline, D. Dimeclocycline. We see that tigecycline is derivative of minocycline. So, our answer is C. 4. Chloramphenicol causes A. Red man syndrome, B. Neonatal abstinence syndrome, C. Gray baby syndrome, and D. None of the above. We see in the adverse effects of chloramphenicol that it causes gray baby syndrome. So, our answer is C. 5th, chloramphenicol is more active than tetracyclines against A. Haemophilus influenza, B. S. typhi, C. Pseudomonas, and D. Proteus. Here answer is A. Haemophilus influenza. So thank you.